It's a little after 12, so let's get started on our County Health Committee meeting. We are today doing the regular and the budget meeting. So I'm calling the meeting to order. The first order of business is Rachel Relaford is going to be calling in, so we want to approve her. Can I have a motion, please? Betty, second. Rob? All those in favor? Aye. Any nays? Okay. Moving on, approval of the minutes, August 23rd, 2022. Can I have a motion, please? Phil? Steve? Are there any corrections on the minutes? Okay, all those in favor? Aye.
Rachel
Any nay?
Relaford. Joined.
Hi, Rachel, we've approved you, so welcome to the meeting.
Thank you so much. Appreciate it.
Okay, so we are on number 3, the budget book. Do we want to take this all as one motion and then we can ask questions as we go, or do we want to take this one at a time? Is everybody okay taking it as one motion? Looks like yes. Okay, so we'll have the budget book on the floor. Can I have a motion to put it on the floor? Betty, second. Rob? Okay. Let's start with any questions on the Health Committee budget.
So, Madam Chair, just like we have done for the last couple of years, we do have a short slide deck to walk through for the committee members. And I apologize for the monitor above your right shoulder and above Jenny. It's a little bit pinkish in color, but it'll be all right. This is a slide that shows by both source of funds, where the money comes from, and by use of funds, how we spend the money. For the entire budget that's recommended before you, all funds, you can see that the source is a little bit more than $148 million, and uses of funds is just a little bit less than $151 million. Second slide is a pie chart that shows property tax distribution. The blue and gray shaded areas are the operational related tax levies. The red and the pink are the pension related levies. What is in the recommended budget, which I expect to probably be altered at some point today or tomorrow, assumes a 4% increase in EAV, and the tax rate is recommended at 83.21 pennies per $100 of assessed value. That is an increase of 0.8 of 1 penny from the current year's rate. Then just a quick note on future year EAV projections. Based on information from the Supervisor Assessment's Office, we are expecting to see some growth for the next couple of years, keeping in mind that calendar year 23 is also the year of the quadrennial reassessment done by the Supervisor Assessment's Office. That will be for assessed values for taxes that will be paid in 2024. As it relates specifically to this committee, your oversight is $10.4 million of revenues and a little bit more than $11 million in expenditures. As that relates to all of the committees, you're roughly 7% of the revenues and 7% of the expenditures in terms of what this committee has oversight of. Looking at the general fund as in its entirety, the recommended revenues are at $50,877,000 and change, and it's a balanced budget right now with expenditures recommended at the same dollar value. As it relates to this committee's oversight of general fund revenues and expenses, there are no revenues generated, or a very small amount of revenues generated by offices or departments or budgets that this committee has oversight of, and it's roughly 2% of the general fund's expenditures. All right, Madam Chair, back over to you, and we're happy to answer any questions the committee might have.
Okay, can you give me an overview on the positions that we have in the Health Committee departments? Are those positions filled positions or funded positions?
Great question. So let's start with Headington Oaks, which is a decrease of half a position. That's the elimination of the finance director position. And then also for this committee's oversight, there's an increase at the health department of 2.5 positions. Two of the 2.5 are infectious disease specialists, and the half is a community health worker. All of those are grant funded. And then additionally, related to this committee, no impact on the total headcount across the entire organization, but reallocation within the organization. We move 6/10 of a position that was the communications specialist out of solid waste management fund or the recycling and resource conservation department. And some of the part of that goes back to county administration. Another portion of it goes to the sheriff's office, which will be in the public safety committee budget.
Thank you. My next question is for Monica, and I wanted you to talk a little bit about the emergency preparedness. You say there's expected to decrease due to over budgeting FY 2022. So just give a little explanation on that if you could. Thank you.
More than happy to. The EMA, or the Emergency Preparedness and Management program area at the health department is actually funded by 3 sources. 2 of them are public health funded. It's our Public Health Emergency Fund, as well as a County Readiness Initiative, or CRI grants. We saw a decrease in one and an increase in one that's pretty much evened out. The other one is our EMA grant, or EMA program grant. Historically, the cycle for the EMA has been off grant-wise from routine state and other state grant programming. And so in an effort to correct that, they started providing a few years where we had, instead of a 4-quarter grant obligation, it was a 5-quarter grant obligation. That actually changes this year. We're now aligned with the July timeline, and July to June. So part of when they do that 5-quarter grant application, if there are some program areas in the state that are not meeting all their funding needs, then that money gets reallocated to the entire EMA program across the state. So part of that 5-quarter is a correction of that, and then the additional cost. We don't expect that this year because we're now back to our 4 quarters, and that really, the extra dollar, so to speak, that happens was because we were on this 5-quarter in a budgeting differential. But now that's cleaned up by becoming back to just a 4-quarter grant and aligning with the state budget.
So obviously we are looking at moving departments. Where is Vital Records going to go? Because I know people think they can get records at the health department as well as down here with the county clerk. So can you talk a little bit about what's going to happen there?
So our Vital Records program is going to be co-located at the coroner's office. So while our program does provide birth and death certificates, the primary purpose of the health department's Vital Records program is that they are the county's registrar, meaning that they register every birth and death. So some of our biggest partnerships is actually with our funeral homes. And so being co-located with the coroner, he has a great amount of space that we have available. So we'll be at that site during construction. But that site will be available as well as Rachel's office will continue to be able to provide that service.
Okay, thank you. All right, those are my questions. Any questions from the floor? Jennifer?
Kind of following up on what Sharon had just said, I assume, and this is slightly off topic, but there will be signage out there so people don't have to go to your side and then track across the parking lot, because that's always what they've done before.
Yes, so there is going to be signage and communications that go out, and I think as part of the general, part of the agenda, I'll go over kind of the status of our phasing out of the health department to answer more specific questions like that.
Rob, did you have a question?
Yeah, this wasn't health department related. My question was in the sustainability budget. I noticed that the fund balance reserve is about 3 times that of their annual budget. And is there something that we're saving for?
No, it's a function. So if you remember, the primary revenue source for the Solid Waste Management Fund are tipping fees at the city county landfill. Historically, those have outpaced the expenses for the department, and it's just simply that. So those dollars can be used for certain things, and recycling education, our own sustainability efforts. A good example of our own sustainability efforts, we actually, through an internal grant-making process, encourage departments and offices to do some type of project in coordination with facilities. So we've done several lighting projects where we've been able to leverage some of those dollars, plus dollars from Ameren to do a lighting retrofit, as an example.
Would we be able to use some of these to offset costs for solar on the new health campus?
Yes, and that's actually something that we've started to talk to Ameren about, and the architects are well aware of, yes.
And then something unrelated, but to the same department. I noticed when I was going through the budget that we're paying a substantial amount of fees in storm sewer to the city. And I would like to challenge Becca to see if we could remediate some of that by diverting some of our rainwater and filling in with some of the programs that the city has so that we can try to remediate some of those fees.
Did you want to make a comment about that, or just, no? But yes, you know, you're aware. Okay. Okay, thank you, thank you. All right, any other questions? Rachel, do you have any questions? Is she there?
I do not. Thank you.
Thank you, okay. All right, with no further questions, we do have a motion and a second on the floor. All those in favor of approving the Health Committee budget, say aye.
Aye.
Aye. Are there any?
Aye.
Are there any nays? Okay, thank you. Moving on, we are at informational items, Board of Health and Care and Treatment Board.
Regarding updates to the Board of Health, just 3 wanted to share with our county board here. First is our Cure Violence. This morning actually, we had our first of 9 workshops throughout the community related to the Cure Violence Readiness assessment. This again is an evidence-based program that really looks at targeting what we call tertiary intervention points. So it's a public health approach. It's been studied and replicated throughout numerous communities in the U.S. and globally. And the focus really is looking at specific, what we call catchment areas, where over years of data, we know where the concentration of gun violence resides, and then really doing an intensive interrupter program in those areas. Again, this is part of a comprehensive plan. It's not meant to be a magic pill, but rather a tertiary intervention point. When I say tertiary intervention points, in the terms of public health, we talk about like community development, basic social determinants of health, economic development, schooling. That's a lot of what we call primary intervention points. Secondary is for high risk, and then tertiary is where individuals are actively involved in whether it's an illness or, in this case, gun violence. So these workshops are the first step. It's really to level set expectations and understanding of the program. And then the second phase will be for Cure Violence Global to come back into our communities, especially in those catchment areas, and start working with community partners, residents, to get an understanding of and get a little bit more data points about the readiness of our community. The third phase will actually be more one-on-one walkthroughs, and then it will end with a readiness assessment as well as a plan and budget for how to provide this into our community. So again, this is just to see if the capacity and the ability for Peoria is there for us to implement such an intensive program. I know County Board Member Duncan was also at today's event, and again, this is one of 9, so we will have 2 more today. I think this afternoon we are at St. Paul's Baptist Church, and then this evening we're actually at Peoria High. Tomorrow I believe we're at Carver Center, at the Health Department, and then Manual, and then our last day is Wednesday. We'll at East Bluff Center, I believe the Health Department again, and then Peoria High. And so I wanted to make sure that we were in that community and providing at different times of day so that everyone is available to attend. The second item is our community health improvement plan. I believe it was either last time I was here or the previous time I did provide you guys with our community health needs assessment. From that assessment, we did prioritize obesity, healthy eating, active living, and mental health as the 3 priority areas. We've conducted a gap analysis, and from that, we're now starting our improvement planning. So on the 10th, 11th, and 12th, we'll be hosting with OSF St. Francis, Unity Point Health, and our neighboring counties intensive workshops to actually break down what interventions that we will be doing to address the gaps for each of our areas. I think it was important to note that when we did our gap analysis, what we found is specifically mental health. There was in Peoria County, Peoria and West Peoria were disproportionately had higher mental health needs than the rest of our counties. So again, when we talk about interventions, we're going to be doing a lot of more focused interventions in that area. And then lastly is our building updates. We are still working through design processes and finalizing that, but in terms of relocation of the health department, we've had walkthroughs on all of our sites. We will be having, and just to kind of give a recap, finance and admin will be taking up some space here at the courthouse. Our vital records program will be at the coroner's office. Our EMA will be at the bunker. And yes, he does understand that it is underground for that period of time, but we'll have 3 staff at the EMA. And then we will have our environmental health program will be at the highway department. We did sign a lease, and we went through that process. We will have our WIC department and dental co-located just off of War Memorial in California at an existing dental office that had shut down. So again, it had the capacity for us to go in there. So we will be starting that process. And then the last one that we are finalizing is a partnership with Human Service Center just down the street here, and that will be for our medical and epidemiology program areas. So that's the last one to go through, but we are very much ready and starting that planning process of getting us geared out. Just in fact, this weekend, we had staff have overtime to get all the files boxed, labeled for destruction and storage, and so it's getting closer and closer now. Very excited.
Okay, is there a report on care and treatment?
No updates for care and treatment.
Okay,
But happy to answer any questions.
All right. So, okay, any questions for Monica? Yeah, Steve, go ahead.
Thank you for the update on the Cure Violence. I guess I wasn't able to attend this morning. I'd like to learn more about it, but you mentioned the tertiary resources, kind of building that out. Is there a funding model that will be needed to help make that work? And has that already been kind of laid out as to where that funding sources come from?
So in every community that's done cure violence, sustained funding is a priority. You don't want to start a program without understanding it. So we are looking at initial funding to build up the program, which has the highest cost. It's the sustaining that is a lot less budgetarily. So right now we're looking at grant opportunities both from the city and the state, as well as foundation dollars to support this initial starting process. And then because it's evidence-based, there is a return on investment that we do collect. So then we are able to then bridge that dollars back into sustain the programs moving forward. But it will be, in some communities, their local governments have recognized the effectiveness of the program, seen the return on investment a dollar of prevention can do, and so they have invested into it. Other communities do a mixed model. So it really depends on the communities as a whole and what's available. But all of them differ from each of those communities. So we are looking at all of those as options for us in Peoria. A lot of it does depend on the number of catchment areas that we will do and the number of staff, which is part of the readiness assessment. So after that, we will actually get a better understanding of what that budget will look like for us.
Okay, thank you.
Any other questions? No? Okay. Oh, Phil, go ahead.
I want to compliment your staff. A week ago this Thursday, I went over a course and had my booster vaccination, and it was efficiently run, and I think everybody that I was around was pretty well satisfied with the way we got in and out of your facility and so forth. But one question I have for you is, and I heard people switching. In other words, if they got Pfizer the first time, they said, hey, I think I'm going to take Moderna. And I know I had Moderna. I stayed with it. And one girl who happened to be, I should say young lady, because I call her a girl because she was I had her as a class, in class. And she switched from Moderna to Pfizer. Now, what do the medical people say about these people switching back and forth?
You can stay on brand or switch. Either one is fine. And actually, I'm glad that you brought that up. It was part of the EMA report, but we actually saw and did 140 bivalent vaccinations that day alone as part of that walk-in. And so it was highly attended, but you can change brands. Some people are become brand loyal for vaccines, which is great, but you're getting the same benefit either way.
Okay. Any other questions? Okay, EMA.
Thanks. Under EMA, first of all, September was National Preparedness Month, so thank you for the County Board for recognizing that through your proclamation. We did a lot of outreach related to it, as well as continue to do some trainings. Our big focus has been, of course, the bivalent vaccine clinics, monkeypox clinics, and also planning for just different aspects. We are part of the team that's looking at if asylum seekers are coming present into Peoria, how are we going to be responding? So again, this is a planning exercise. We have not heard one way or the other, but it's important. What we learned from COVID is that to have that framework and have those partnerships available. It'll be slightly different. I don't think the health department will be instant commander, and I'm okay with that for any type of a response like that. But again, it's making sure that we have those key partners. And Jason Marks, having what he did during COVID, had a great framework. So really building from that to be prepared for what may or may not happen.
Okay. Any questions on EMA? Go ahead, Steve.
Could you speak maybe a little bit on the equipment status part of the report that Jason gave us? I know he's not here at the moment, but I know in the past, maintenance of the equipment for the sirens and those have always been somewhat a challenge to get replacement parts and such. I like the fact that he put that in as a heads up that that needs to be reviewed. But any more commentary around the timing or anything else around that?
So I think what Jason's working on is twofold. With our current existing infrastructure, if a part goes down, how quickly we are able to get replacements. And the supply chain has actually been moving more and more quickly. So we're not seeing the delays that we saw earlier this year. Having said that, what's happening now is our actual radio infrastructure is starting to age out. And so now it's looking at what options that we can do. At the same time, is our current map or overlay of sirens, where do we have duplication, where do we have gaps, especially as Peoria grows, you want to make sure you're placing the sirens in areas where there's growth cells. And so part of moving forward is to really look at the overall infrastructure to make sure that one, our radio systems and the notifications are being updated. I think that's where he's looking to ETSB for some guidance and some recommendations as well. And then also looking at where we may be decommissioning or putting in new notifications just because of the changing kind of population centers in Peoria.
Any other questions? Okay, thank you. Okay, moving on, ROE. Yeah, no pressure.
I always get that no matter where I go. Always asking if I'm going to have as much energy as Beth, and the answer is no. And I'm younger than she is, which doesn't help me at all. But, so just a couple updates. We are happy to say that it is a sort of like close to a pre-2020 start to our school year, right? Things are pretty positive, a lot closer. I should say we moved a little bit further away of viewing it as pandemic year, so we're excited about that. Some of you will know that our alternative school at Wildlife Prairie Park is relocating to the Franciscan Recreational Complex. We anticipate that after a delay with getting our work and construction up and running, that'll actually start on Monday, the 10th. We anticipate that will be done, and we will start our classes on December 1st. And so we're really excited to essentially open ourselves back up to being able to take students from Peoria Public Schools, because we'll be on a bus line. West Peoria and the Park District are going to be fantastic partners for us, and so we're really excited about that move. We'll say our school districts are really focusing in on school safety, which there's always a focus, but now that we're able to sort of move beyond some of the other things from the last couple of years, and so we've held several trainings there with outstanding attendance, and we were fortunate enough to get some extra money from ISBE in one of our funds that we get in, one of our budgets that we get in, and so that money was earmarked for truancy, and so we will have 3 more truancy folks out working with our school districts, and that's probably the number one issue that most schools will face this year, is sort of where those kids have dropped off, and then us helping to locate those students. And we also recently got a grant for we call it it's oftentimes PI program, but we call it Birth to 3. So we have a supervisor, and we'll have 3 at-home workers, teachers that will actually go to homes with students that are birth to 3 and do lessons and do types of learning with not only the parent but with the student there in the home. And so we're excited to be able to have that work and expand what we're doing for our kids that are 5 and under. So that's the update, not as energetic.
Any questions? I have one.
Yeah.
So the truancy rate, I know this was a really big problem during COVID. How do you feel it's going, and do you see those numbers as folks are they starting to get back into the school, or is it still quite a big number?
So the number in particular, Peoria Public Schools has a significant number of students. It's over 50% that are considered to be chronic truants, and so we would anticipate that number is probably going to be the same, but better than the pandemic years, right, where kids were just either not logging in or not participating in their online learning. And so we hope that number will slowly drop. I don't know that it'll be something that we may see a great reduction this year, but all of our schools are focusing in on it, and so they've got personnel. Obviously, the wraparound center is working diligently. We will actually have one of our truancy workers will be at the wraparound center, and that'll be their home base. And so we anticipate the number will change and it will get better. Maybe not significant this year, but I think over the year and into next year it will for sure.
Continuing on that.
Yeah.
Can you talk a little bit about the challenges that the teachers are going through with this issue?
With truancy?
Mm-hmm.
So what we know is that kids that aren't in the classroom and aren't at school aren't learning. And students that aren't learning and aren't in school and they're finding themselves falling behind, it becomes a burden on the teacher because they are working with their students that are in the classroom that are, on pace to complete units, complete whatever they happen to be working on at the time, as you then bring students back in that might have missed. So teachers then have to not only work with the students that they have currently, now they have to go back to help to bring those students up to speed as soon as possible. And so our teachers are facing incredible burdens, not only with truancy, but with any number of issues that are going on in education right now. But certainly working with kids that might be struggling, might just need some extra work to get themselves back on course is a difficult task. Yeah, for sure.
Thank you. Any other questions? Okay, moving on. We are at sustainability.
Good afternoon. I just have a few updates to what was provided in the agenda brief. Starting at the top there with collections. The Limestone Township collection was last Wednesday. We doubled the number that we had last year with just opening more appointments. Had 126 participants, and approximately, we don't have final numbers yet, approximately 9,500 pounds of electronics were collected. So those smaller collections with assistance from townships is something I'm kind of trying to to model. So I appreciate Limestone Township's partnership in doing that. So we can kind of grow that way, as opposed to one-day huge collections that sometimes don't serve everyone anyway. So some sort of targeted collections. Tazewell County hosted theirs on, which was open to Peoria County residents on Saturday, and they received they don't have pounds yet, but 2 full semis and a box truck full. And that was a program that people were paying for drop-off, sort of in lieu of using Kusakowski that we have here in town. Our unincorporated township work continues with Limestone Township sort of coordinating those efforts. We do have a survey that's still on our website with 101 responses so far, so better than it was. But still, if you would like to encourage any of your residents to take that survey, we continue to promote it through social media, and then it is on our website as well. We did receive a planning grant from the IEPA for resource management plan updates, which we have already started working on. What else? Let's see. Also, we do have a few, we've had some interest in CPACE. Again, no projects to bring forward yet, but more interest is continuing to, happen, which is great. Regional Food Council, we have selected a date for a meeting, working with the Community Foundation. That'll be January 24th. We do have an extra date just in case that doesn't work out for the speakers that we've identified. Unrelated to sustainability, United Way campaign is closing soon. But we did have 2 successful auctions, one at the health department and one for all county employees, raising about $2,500 between those 2. And then again, with employee contributions coming in still. With the sustainability update, the usage for it should be through the second quarter of 2022 for all buildings, both natural gas and electric, are listed with natural gas usage dropping 5% over 2021 and electric 11.2% over 2021. And most of that can be attributed to lighting upgrades at the jail and the courthouse, making a big impact. For the third quarter, when I bring that forward, I'll be sure to pull out those 2 buildings so you can see the difference. Also, 2 applications were submitted on Friday. Ameren was doing some sort of really quick turnaround natural gas projects for the public sector. So there's potential for 100% funding for a couple small projects. So we did submit one for a high efficiency boiler at JDC and a burner application for the courthouse. So the turnaround on those is to find out if we're accepted is usually only a few weeks. So that would come forward to the infrastructure committee as soon as we hear anything. And that's all I have, unless there are questions.
Are there any questions? No questions? Okay, thank you. We are at Triad. Mike?
Yes, ma'am. Okay, I want to call your attention to the handouts. I have handouts for you. The top card is just a general introduction card. Every event that we go to, we have these available for anyone to pick one up to learn more about who Triad is, what Triad is. So you have a copy of that. Also, you have two color sheets. The first one, because today is considered an update, I put the original in here for folks that maybe don't remember a year ago when I was here. And so I'll just go through the update pieces right now. Since first introducing Peoria Triad to the committee in September of last year, I'm pleased to say that we're making strong progress, not only in membership participation, because COVID really put the death knell into the group for a while. And now everyone is participating very nicely, and consequently we get to refocus on our goals and reinforce our general mission. The mission generally is, regardless of zip code, PCT works to provide safe local forums where discussion topics on health, safety, and welfare can be presented by local agencies and experts. And when I say local agencies and experts, if you go to the other handout, that's our Peoria County Triad Speakers Bureau sheets, it lists all of the topics and the organizations speaking to those topics. We have these people booked very frequently, and what we're in the process of doing is actually expanding on some of those topics based on the questions that they get during their initial presentations. So you have a copy of that you can look at and peruse when you have a moment. The presentations are followed by Q&A, where seniors present questions and concerns to the presenters on a first-person level so that we actually have a chance to answer those questions. One of the biggest frustrations that we have when we do outreach is that individuals that are experiencing day-to-day problems, if they call, I don't know, generic numbers, 211 or whatever, oftentimes they get kicked to a resource that is actually a funding source as opposed to a let's get it done source. And so consequently, 2 or 3 phone calls later, they get frustrated and give up. Our goal is, when we're in front of these folks, we actually take names and phone numbers, and they don't have to go through the frustration of trying to get help. We can help accomplish that for them. And like I mentioned, the good news is our calendar of engagements has something nearly every single week now. And if you go to our website, you'll see the listing of what we have on our calendars. Within the last 45 days, I've had calls or meetings with Carver Center, Peoria Housing Authority, and Neighborhood House. Each one of these groups has expressed their desire to work with us so that we can form grassroots groups of seniors that reach out into the neighborhoods where they have a hard time getting those people to come to them. And so consequently, by doing that and by using not only their facilities, but some of their expertise in reaching some of these neighborhoods, we have a real opportunity to get to the folks that everybody has been mentioning today. So consequently, we continue to work with not only everything that's on the Speakers Bureau, but as an adjunctive effort to the Cure Violence, which I frankly just heard about like 2 weeks ago. And the business growth initiatives in our area, I really believe that positive change is happening when we get to the individuals. And so that's our whole approach, get to the individuals. Lastly, on September 12th, I got a phone call from Amy Brown at the Illinois Department of Aging. She saw our website and was making sure that I had seen the grant opportunity for triads. I told her I had not seen it. She said that Illinois triads are few and far between, and because we can point to our success in the engagements in Peoria County, to please apply for the grant dollars, which we did. And those grant dollars are coming through the American Rescue Plan and Adult Protective Services. All of this really means that the need is widely recognized and the PCT model is poised to be very successful. However, success also means that funding and strategic relationships need constant attention. And so consequently, I really think that we might have an opportunity to work more closely with this committee in reaching out into everybody's respective districts. That's all I really have to say, other than just maybe answering any questions you might have.
Any questions? Rob?
Thank you for coming, Mike. Could you maybe just explain what the red envelope is to everybody so they know?
Sure. Did everybody get one? Could you hold it up again, Rob? Yeah, there you go. Peoria County Triad purchases the Files of Life, and now what these were originally meant to do back in the 90s when the idea first came up was that all of the sheriff's department personnel would hand these out. That didn't work as well as they had hoped, and so the triads, which were more populous at that time, we started handing them out to let seniors know that if you fill out the health information that's requested in there, put it on the refrigerator, then any first responder who comes into your home will have access to the medical information that they might need to make a difference in that call. And so routinely we buy these things every year to hand out at every opportunity. Just last weekend we handed out 300 of them to a seniors event hosted by the Area Agency on Aging. And so everyone appreciates it. I don't know if everybody uses it, but we certainly have an opportunity to make sure that seniors are safe, and we're just part of that equation.
Any other questions? Go ahead, Rob.
I just wanted to say thank you for the work that you're doing. I know when you first contacted me a couple years ago, the future of the organization was pretty bleak, and you persisted. And I think it's because of you and your efforts that the organization has grown to what it is. And I just want to congratulate you on that and thank you on behalf of the seniors of Peoria County.
Thanks for the recognition. Obviously, I can't do it by myself. I've got a really great group, and they just needed a little re-encouraging that what they were doing, the reason they were there, is paying off. People respond when they can see that things are paying off. Thank you.
Rob, and I appreciate you serving as our liaison on that committee. So, any other questions? Mike, thank you for coming.
Sure.
Okay, we are at miscellaneous. Do we have any miscellaneous? Any miscellaneous? No? Okay, then we're adjourned. Thank you.